In this final part of emotional behaviors, I'm going to end with fear and anxiety, and so those escape behaviors. And then there's this very tiny sliver that I at least wanted to mention other emotions as attack and escape behaviors. It's a bit easier to point to something, to some area of the brain that we can say, we're going to look at these different areas of the amygdala and see where it's active to these specific emotions. But we have other emotions that typically get ignored in the textbooks just because it's more difficult to point to somewhere in the brain, as I showed in one of those really early slides of the brain. This is your brain on emotions, that they're really all over. There's activity all over the brain and for a lot of these emotions. People's tendency for anxiety remains fairly consistent over time. We can see that we sometimes have a tendency towards slightly more anxiety or slightly less anxiety as we age, depending on life circumstances. But overall, this is a relatively consistent tendency. We see this even in infants. So they have looked at infants with inhibited temperament. And so inhibited temperament refers to infants who are slower to warm up. They are uncomfortable in novel situations. They're uncomfortable and fussy often when they meet a novel person, so with unfamiliar people. And what they found was when they show pictures of unfamiliar people to these infants with inhibited temperament, that the amygdala is more active. They did a study with college students where they had people wear beepers for 28 days, and the beepers would go off randomly throughout the day, and the person is supposed to write down aspects of their emotions. And those college students who were writing down more unpleasant emotions overall, they took all the college students in a year later and they looked at the fMRI, and those college students with more unpleasant emotions had a higher amygdala response to frightening photos. We also see this in soldiers. So they looked at Israeli soldiers and showed them frightening pictures. And those soldiers who had high levels of amygdala response initially, before going into combat, they were more likely to show combat stress. While our general kind of anxiety depends a lot on the amygdala, and as I mentioned before, generalized anxiety, we see that activity in the bed nucleus of the stria terminalis. There are other influences on how much anxiety and fear that we have in response to situations. And again, this can change as we age based on many things, but one of the things we can learn to do is to learn to reappraise. So I think he gives the example in the book of, we think we hear a gunshot, but we think, oh, that could have been a firecracker or a car backfiring, or if you live in my neck of the woods, you think that's probably a hunter or people shooting at their targets, because that happens around here. And when you're reappraising so that you don't have that kind of fear response, I used the example before of a garden hose looking kind of like a snake. And if you do take the second look and reappraise, you're really using the prefrontal cortex to inhibit amygdala activity. And I mentioned really early on that I was going to start bringing in the prefrontal cortex and its importance as an inhibitory kind of mechanism. So these are top-down influences where you are reappraising, and this strengthens those connections so that we can inhibit amygdala activity. And we have stronger connections, allow people to make more use of reappraisal. So this is one of those cyclical things that the more we practice it, the better we're going to get at it, because we are developing those connections. People who have damage to their amygdala, when they are looking at emotional photos, they can classify them just as well as anyone else as being pleasant versus unpleasant, and according to various emotions. I'm going to qualify that in a moment. They don't have as much emotional influence from those photos. They also experience very little arousal from viewing unpleasant pictures, which we just saw. Sort of the more amygdala activity to unpleasant pictures, probably the more anxiety, the more tendency for battle fatigue and negative emotions that we see. But these people experience very little arousal from unpleasant pictures. So, but they're able to identify. So the cognitive aspect is intact. The emotional response is what is not available. One of the people who is pretty famous for having damage to her amygdala is SM. There's been lots of research done on this patient, and as usual, we use just the initials to protect her privacy. But she has Urbach-Witte syndrome, so where the amygdala just wastes away as it just loses its calcium in that area, and she tends generally to avoid eye contact. I'm showing some pictures there over to the right where she has drawn various emotions. That's why I said before I'm going to caveat this. They're pretty good at identifying emotions, and you can see when she's asked to draw emotions like happy, sad, surprised, that she is drawing those all right, and even has some amount of might be going on with the eyes, but it's really the overall face. Whereas when they ask her to draw fear or somebody who's afraid, you can see that she drew this strange sort of cartoon baby kind of facing away. One of the things we see is that when people are afraid, we look to their eyes to see that fear and to see what they are afraid of, what they're looking at. And she tends to avoid eye contact, so she's lacking a couple of things here, both looking at the eyes and the experience of fear, which go together to a large extent. They have several examples of her fearlessness. One thing she does that makes other people uncomfortable is just to step very close to other people, because usually what happens is we get really close to someone when we're talking. There's an amount of nervousness or anxiety, and that's just not there in her. She has gone down dark alleys and gotten herself into some really scary situations that for her weren't scary. They were very dangerous situations that she just wasn't aware of kind of the danger, or that she should be afraid. And this picture is of her actually holding a snake. And so this is not a poisonous snake, but even before going into the pet shop, she tells them, "Oh, I'm deathly afraid of snakes. I've always been afraid of snakes." And this is said very deadpan, right? She's telling them she's afraid of snakes, but as they go in, she is happy to pick up a snake. And in fact, they have to stop her from reaching in and touching the poisonous snakes, because again, she's just not thinking through the dangers and how she should be afraid. In this study by Whalen et al., 2004, you can see, so they had the eyes on the left, just those wide eyes. So again, I'm going to say that the eyes tell us a lot about people's emotions, but particularly fear. The eyes on the left, get my, as you're looking at it, the left with the wide eyes, that we tend to interpret that as fear, and that's what the researchers were trying to do, was to show fear. And the ones on our right, as we're looking at the PowerPoints, might look happy. They look a little bit sleepy to me. We'll say that maybe I actually think the emotions are quite a bit more ambiguous in that. But if we look at how people rate those, fear and happy are the two, for those two, for the left and right, are pretty typical. If we go in and look at the percent signal change in the amygdala, looking at these eyes in comparison to a control condition, you can see that there's not a lot of signal change for the happy eyes, or for what I call the emotionally ambiguous eyes. And there is a great deal of signal change in the amygdala when we look at just the picture of eyes that are suggesting fear. We also have fMRI studies that suggest that the amygdala is responding to emotional stimuli and facial expressions, but not just to fear or anger, because remember, aggression is another aspect of what we think of as emotional processing in the amygdala, and why I keep saying it's more than just aggression and fear. or anger and fear that the amygdala is responding to. So this particular study looked at the amygdala response, so the percent signal change of the amygdala to, okay, on the left, on the far left is someone who is angry and their eyes are looking at you. Okay, well, that's something that we tend to understand, as we've probably had parents, teachers, people who are angry with us talking to us, and they're angry and they are looking at us. And so we have some signal change, and the amygdala is responding, but not to the same extent as the one next to that, where the person is showing anger and their eyes are averted. So at this point, that facial expression is showing something that's really ambiguous, and the question, we don't see that as often, that somebody is angry, but to something else or somebody else in the room or around, and that's giving us this ambiguity that we need to figure out how to interpret, and that is actually what the amygdala responds more strongly to. I'm going to move over to the far right. So fear averted is what the facial expression is showing. The eyes are averted and the face is showing fear. And what we see is, again, some signal change. The amygdala is responding to fear on a person's face. And we often look right at the eyes, right, to figure out what are they afraid of? Where should I look to see what they're afraid of? But notice the one just to the left of that. That is someone showing fear with their eyes directed at us. And that is where we see more response of the amygdala, because again, this is pretty ambiguous and this is pretty difficult to interpret, because it's not very often that we see somebody look at us like they are afraid of us. And that's a really ambiguous situation. And there again, that's where we see the response of the amygdala, not necessarily just to anger and fear, but to these really ambiguous situations and ambiguous emotions that are difficult to interpret. So far, a lot of this research is suggesting, so both the damage to the amygdala and the response of the amygdala in these different situations all suggest that rather than the amygdala being responsible for feeling fear and other emotions, or detecting fear and recognizing fear, perhaps it is really responsible for detecting emotional information and directing our attention to that appropriately. When there's an emotional situation or emotional information that is available, we need to direct our attention to respond to that appropriately. One type of anxiety disorder is panic disorder, where what happens with these people is they have frequent periods, or they have times when they have a really intense kind of anxiety, and they'll start to have that whole autonomic nervous system response of rapid breathing, increased heart rate, sweating and trembling, and they sometimes read that as it feels like they're having a heart attack, which puts it into this kind of cycle of that causes more anxiety, which creates sort of a longer panic attack. And the panic disorder is having this either frequently or enough times that you're going to call it not just a panic attack, but a panic disorder. And this disorder is linked to abnormalities in the hypothalamus rather than in the amygdala. So the hypothalamus sending off the cues of the hormones and the fight or flight response. It's also linked to lower gamma aminobutyric acid, or lower GABA levels in those people, and higher orexin levels in people who tend to have panic disorder. Another anxiety disorder that gets talked about quite a bit these days is post-traumatic stress disorder. So this involves somebody living through some severe trauma and then having frequent distressing recollections. So these flashbacks to the trauma, nightmares of the event. They tend to try to avoid reminders of the event, and they also have vigorous reactions, or really some autonomic nervous system reaction to noises and to other stimuli that are triggers for remembering the event. One thing we see, and we're not really sure what causes some people to have post-traumatic stress disorder in response to a traumatic event, and some people to not have this kind of reaction. What we do see is smaller than normal hippocampy in people who have post-traumatic stress disorder than people who go through a trauma and do not have this kind of disorder. However, we don't know what direction that goes in, right? This is your regular brain size and experience, behavioral experience kind of correlation where which came first, we don't know, and whether there's a third variable, we don't know. I have this is not in your book, but I also have here as the question mark next to serotonin, really maybe low serotonin levels, as we see people who are depressed and people who have low serotonin levels, they also have smaller than normal hippocampy. And what we also see is that they sometimes prescribe a selective serotonin reuptake inhibitor for people who have PTSD. So that all appears to be somewhat related. But again, exactly what's going on with the people who do experience this versus people who don't experience this is not completely clear. A relatively common treatment for anxiety disorders is to prescribe anti-anxiety drugs. As much as possible, people move towards any other answer, sometimes cognitive behavioral therapy, because they're very reticent to prescribe these drugs as they are very addictive. They are a controlled substance and they are quite addictive. So the benzodiazepines is this family or class of drugs that include diazepam, which we know as Valium, chlordiazepoxide, which we know as Librium, and alprazolam. That one's always hard for me to say, which we know as Xanax. All of these, what they're doing and what this is showing is they are binding to the GABA A receptors and facilitating the effects of GABA. So we would call these an indirect agonist, as they are facilitating the effects of the neurotransmitter. As I kept saying, I really think that these other emotions are really important and that we tend to stay away from them as they are not easy to look at. And the first one I'm going to talk about is still staying on a kind of negative note as far as our emotions. And I want to just say we have a lot of positive emotions, and I think one of the more powerful things we can learn to do in our life is to learn how to laugh at a lot of things, especially ourselves, perhaps. But so I have this under joy, even though I'm not sure it belongs completely under joy, but we do have a reward pathway where the ventral tegmental area of the brain is producing dopamine, and that goes up through the nucleus accumbens. And again, as I said, this is often still looked at from a relatively negative perspective. So Ken Bloom has done quite a bit of research looking at a reward deficiency syndrome, so people who are weak in this reward pathway. I think I mentioned this before when very early on talking about brain structures, when I talked about ADHD, of them having low dopamine going through this, what's called this mesolimbic system, because it's what's weak in them in people with ADHD is the mesocortical system, which is actually going up through the nucleus accumbens and the limbic system and up to the prefrontal cortex. And so not only do they have difficulty paying attention from the lower activity of the prefrontal cortex, but they also are more likely to become addicted to drugs or have some kind of substance abuse problem. And that's what Ken Bloom is looking at, the reward deficiency syndrome. But the nucleus accumbens and this part of our limbic system is really important for emotion, motivation, and addiction as well. It tags information as something for other brain areas to pay attention to, and we will talk about this area again when we're talking about learning and memory, as well as when we talk about psychological disorders. But I didn't want to leave things there because, again, I felt like that stayed on a relatively negative aspect of even joy and happiness and pleasure. We also have love, and love, according to Helen Fisher, we have different kinds of love that we might want to address, like lust, attraction, and attachment. when we are truly just infatuated with somebody in this kind of lustful way, we are releasing those hormones, the estrogen and the androgens. When we become more attracted to somebody and maybe more infatuated in a more long-term way, where we're having those really intense emotions about somebody, it is associated with elation and craving for emotional union, craving for being with that person. And we see release of the monoamines, so all of those, dopamine, norepinephrine, epinephrine, serotonin, all my monoamines. We also see a release of oxytocin, which we talk about as the bonding hormone, but it is a stress hormone, but it also does influence our bonding. We also see a release of endorphins, which we've now talked about in as relieving pain, but also as an aspect of pleasure. And we also see a release of phenylethylamine, which I had not don't really know much about phenylethylamine, but it is sometimes referred to as the love hormone. And when I went to look it up, funny thing I learned was that you can buy it. That's the first few links that I got were places to buy phenylethylamine. Don't go buy phenylethylamine. That's silly. It's better to just fall in love and have some attraction and release the love hormone as it's known. And if we're going to talk about real love, so long-term attachment kind of love and long-term relationships and um, uh, feeling close and intimate and making commitment, that is much more difficult, which again, the reason we look often at things like aggression and attack and escape behaviors is because we know here we can look in the amygdala. Long-term attachment and real love is just much more difficult to examine. My final slide on joy, which I don't know how much of this really belongs under joy, but that's where I put it, is laughter. And laughter is another thing that's really difficult to explain. The neurochemistry is hard to explain. So I went and found just a few pieces of research to talk about. One was Robert Provine coded 1,200 laugh episodes, and he found that social context is important. We laugh when we're nervous, we laugh when we're amused, and we sometimes laugh cynically in response to disappointment. What this means is what's happening in the brain. Again, it's hard to explain. We're laughing under different conditions. Researchers caused a 16-year-old girl to laugh by stimulating areas of the left frontal lobe and the supplementary motor cortex. And she would make up stories about why she was laughing. So they would make her laugh by stimulating motor areas. And then she would say, well, you just did something funny. So her laughing itself caused her to create a reason for the laughing, but really that was just created by stimulation of motor areas. My last example is how laughing can be contagious, and to very quickly just introduce this concept of emotional contagion, that we do take on other people's emotions, and we talked about mirror neurons and how influential those might be in empathy, but seeing people who are sad, and we're watching a movie, we can feel really sad. Laughing is also contagious, and watching people smile and laugh can help us to smile and laugh. However, the incident that I found, that the first few times I talked about this, I thought this is hilarious and really neat, was an epidemic in, I can't say this, Tanganyika, somewhere in Africa in 1962. Schoolgirls laughed for 6 months before the school was shut down to contain the epidemic of laughter. I learned later, so I thought this was funny, and it does talk about emotional contagion, but I learned later that this was actually one of those not good reasons to laugh. So this was in an area of Africa where people were coming in, and the school systems were teaching more developed nations kind of westernized ideas of what children needed to learn. It really went against what they were learning in their home lives, and some of these small towns that were feeding into these schools, schoolgirls would start laughing, but it was more like that kind of nervous laughter, or that laughter when you're really uncomfortable and something's really wrong. And that then started this sort of contagion of laughter in the school, and it traveled into some of those smaller towns where whenever the girls would see each other, one would start laughing and another would start laughing, and they would just start laughing, but it was not a happy laughter. So while again I wanted to find information about uh, brain chemistry and brain regions that were involved in some more positive emotions, I did not do the best job, but I think it really is because the science is not strong in that area, because it's very hard to explain. We're seeing it all over the brain. There's nowhere we can point to, hey, this is where happiness lives. Okay, that's my end of emotions. I know I went long, and I'm going to start learning in memory today.